Hi viewers, welcome back to our channel. Now it's a time to review new ICD changes for the year 2023. From October 1st onwards, these changes will be effective. I will post chapter-wise updates. Keep watching. Please share and subscribe our channel for coming to 2023 ICD revisions. Total codes are 73,639, new codes are 1176, 251 codes are deleted, 36 codes have been converted to parent codes, 28 codes are revised. Among the new codes 1176, the major changes are in dementia, endometriosis, maternal care for the fetal disorders, head injury, motorcycle and bike accidents. And many other codes have been created in other chapters, and some of the codes have been further expanded to assign more specific ICD. Several terms have been revised. Inclusion terms have been modified, and we will see all the changes chapter by chapter in our videos. Coming to this video, let us review chapter 1 and chapter 2 changes. Coming to the chapter 1 and 2, very few changes are there. Hardly there are 4 changes in the chapter 1 and 2. First, let us see chapter 1 changes. Coming to the chapter 1. Infectious and parasitic diseases. The code range is from A00 to B99. Category A81, a typical virus infections of the central nervous system. Additional code list has been revised. First, what is use additional code? Use additional code notes found in tabular list. It indicates a secondary code is required to fully describe the condition if known. That means another code may be needed to completely describe the condition of the patient if the condition is mentioned in the medical record and if it exists. Always assign an additional code. Coming to the codes. A81, a typical virus infections of the central nervous system. See the description, use additional code to identify. Whenever the patient has associated dementia along with atypical virus infections of the central nervous system, it should be assigned. Coming to the 2023, the dementia codes have been revised and created 87 new codes based on the severity and associated behavioral disorder. While assigning dementia codes, review the new ICD guidelines and assign most appropriate code as per the revisions. And we will see dementia changes in chapter 5 video. Coming to the candidiasis of vulva and vagina. Candidiasis is nothing but the infection of the skin or the mucous membrane due to the fungus candida. The new codes have been created for acute, chronic and recurrent candidiasis of vulva and vagina. Till now we are reporting with one code, that is B37.3 for candidial vulvovaginitis. It is also called monilial vulvovaginitis, vaginal thrush. New codes are B37.31 and B37.32. B37.31 for acute candidiasis of vulva and vagina, B37.32 for chronic or recurrent candidiasis of vulva and vagina. NOS should be reported with B37.31. These are the 2 changes for the chapter 1. Now we will see chapter 2 changes. Chapter 2 is Neoplasms. The code range is C00 to D49. Coming to the chapter 2, T-cell lymphoma and myelodysplastic disease. Code description contains the text not classified has been revised to not elsewhere classified. Not classified means provider did not specify the type of the lymphoma. Not elsewhere classified means there is no specific code that describes the condition, although the physician specify the type of the lymphoma. There is no much change in the code assignment, but as per the revised description, the code meaning has been changed. Coming to the codes. For peripheral T-cell lymphoma, the codes are from C84.40 to C84.49. C94.6 is myelodysplastic disease. The old codes contains the description not classified. New codes, this text has been replaced with not elsewhere classified. For example, C84.41 peripheral T-cell lymphoma not elsewhere classified. Lymph nodes of the head, face and neck. As per the new description, this is the one example. And coming to the secondary malignant neoplasm of the lymphoid tissue. When a patient has malignant lymphoma and it has been metastasized beyond lymphoid tissue to other organs, do not assign a code for the secondary neoplasm of the affected solid organs. Assign a code from C81 to 85 with final character 9, which identifies extranodal and solid organ sites. Coming to the examples, the patient has metastatic diffuse large B-cell lymphoma and it has been metastasized to lung and brain. Then assign C83.89 diffuse large B-cell lymphoma, extranodal and solid organ sites. The next example is the patient has metastatic small cell B-cell lymphoma and it has been metastasized to adrenal gland. Then assign C83.09 small B-cell lymphoma, extranodal and solid organ sites. In these examples, the lymphoma has been metastasized to lung, brain or adrenal gland. So it should not be assigned the secondary neoplasm of the lung, brain or adrenal gland. The secondary malignant neoplasm of the lymphoma should be reported with C81 to 85 with final character 9. These are the changes in chapter 1 and 2. 4 changes. A81 dementia code list has been, additional code list has been revised. B37 new codes for acute, chronic and recurrent candidiasis of vulva and vagina. For T-cell lymphoma, the text not classified has been revised to not elsewhere classified. Secondary malignant neoplasm of the lymphoid tissue should be reported with C81 to 85 with final character 9. Please keep watching. We will meet soon. Another video with chapter 3 changes. Bye.